Okay, hi everyone. Welcome to the knee exam. My name is Dave Bernard, physiotherapist, Back in Motion. I'll be acting as the patient. Jessica Edwards, physiotherapist and clinical practice leader, Back in Motion, will be the assessor. A couple quick points on telehealth in general. Prior to starting every telehealth appointment, please make sure that you have a secondary point of contact or contact number for that client should there be an IT issue. Also, confirm their emergency contact information, and also confirm that they're joining the session from their listed home address. For new assessments, please confirm your identification, and we also ask that you confirm the identification of the client. For yourself, sharing your college registration card, probably up to the camera, is good enough. Any government ID for the client, BC driver's license, etc., would be sufficient, of course. As with any telehealth session, and that can be both for new and or subsequent, please ask yourself 3 questions. Is an in-person physical exam required for this condition or individual? Can substantially similar care be delivered via telehealth as compared to in-person? And do patient factors such as sensory, cognitive, or physical impairments impact the ability to deliver appropriate care via telehealth? Okay, so with that, Jessica?
Thank you very much, Dave. So for the knee today, we're going to start with some of our functional movements standing up. And of course, you'll have to use your discretion with your clients and your belief of their safety doing balancing and standing up. So some of these tests may just be done for sort of higher level or more athletic clientele. To start off with, we're going to look at screening just a squat. So Dave, if you could stand up a little bit further for me and maybe tilt the camera down so we can see a little bit more of your hip and knees, and even towards your feet a little bit more, that'd be great. Thank you. So feet comfortably apart, Dave. Could you show me a squat down as far as you feel comfortable? Good, and back up. And you can also take a look at the side view. If you can go back down and back up, you can sort of take a look at a little bit more of that functional sort of knee range of motion they have, and back up. Now, if you face me, Dave, holding onto the wall for balance, we're gonna do a little bit of a mini single leg squat. So sort of if you can come down sort of halfway on the one knee and back up, you can sort of take a look at a little bit of their alignment. And other side for me, potentially even more for patellofemoral pain syndrome, a little bit more of a pain provocation. Good, and come on back up. And of course, if you wanted to, if you suspected some ligament instability, you could take a look at their single leg standing, either eyes open or eyes closed. Thank you very much. You don't need to assess that through on Dave per se. So after the functional testing, there is one more standing test. It's a special test called Thessaly's, which you can choose to do, before or after the rest of your assessment, depending on how comfortable you feel with the client. Thessaly's is a good, pretty accurate test for picking up some meniscus dysfunction, but it does require more upper or higher level function. So you're gonna instruct them to be standing on one leg, holding on to something for balance on the side. You're gonna get them to be in about 20 to 30 degrees of flexion. So bend your knee a little bit more for me, Dave. Yeah. From here, keeping your other leg off the ground, I want you to use the wall or chair to rotate yourself through with a little bit of speed all the way around and back, really twisting on that knee. See if you can do it 2 or 3 times if that reproduces some of their pain or their clicking or locking. Okay. Yep. Good, thank you very much. So if we move on to a range of motion assessment, we can, once again, you can sort of choose which might be more comfortable for you and the client to be able to do this in either sitting or supine. It often is good to be able to follow along with clients, so you can choose to have space to lie down yourself. If you're doing it in sitting, you'll likely try to see if you can get them to perch on the edge of the chair, see if they can bring their heel into their bottom as far as they can, and even potentially add a little bit of overpressure. It can get a little bit awkward with chairs sometimes, or if they're a little bit inflexible, that might limit them more than it should be. But you can also take a look at extension, getting gravity assist, or even getting them to assist on a full knee extension if they have this sort of hamstring flexibility and nervous system flexibility that way. You can assess it in that direction. For resisted isometric, if we're doing this in sitting, you can do self-resisted isometric, typically by If you're assessing this side for quadriceps, you can hook the other leg in front. Yep. And then you're going to instruct them to see if they can try to straighten out this knee, trying to push into their ankle, see if that reproduces some of their, if they have sort of a quad pain. And then you can compare side to side, see if they can feel like they are having more difficulty one side or the other. And for hamstrings, the position looks about the same, but the movement's opposite. Of course, you're trying to instruct them. If you're testing this leg, you're going to try to cue them to bring their heel back into their other leg, and then you're going to switch side to side. See if you can get some of that resisted isometric. If you're doing it in supine, Dave, if you have some space to lie down on your back, you can sometimes get a little bit more of an accurate idea of their knee range of motion. Very good, Dave. Can you slide your heel along the ground towards your bottom as far as you can? And if they have the flexibility, they might even be able to nudge it in a little bit with their hand, get a bit more of overpressure. And then also trying to straighten out and lock it out as far as they can. You'll be able to also potentially see if Dave moves his head, backs up a little bit so I can see your feet, Dave. Yep. You might even be able to see if they can achieve a little bit of hyperextension on that one as well, if they squeeze their quad out as high as they can. From here, you could also assess a bit of a quadricep leg. If you get them to straighten out and lift up their foot about 6 inches off the ground, you could potentially see a little bit of that functional stability. If they are sort of post-ligament injury, you can look a bit of an extensor leg there. Good. Now, the other option, thank you very much, Dave. We'll have a seat up. The other structure within the knee that you might be able to investigate with your client is a little bit of that patellofemoral pain syndrome. So some of the tests that you might be able to try, if they're able to get a bit of a straight leg, is the Clark's grind test. And this one, what they do is they, if they locate their kneecap, they want their hand sort of just over top of their kneecap, and this can be very pain provocating. But if you get them to put just some light pressure down onto their kneecap and then get them to sort of try to squeeze their quadricep muscle and tighten it up, and that kneecap is sort of underneath their hand, you might be able to get them to tell you about sort of crepitus, sharp pain, if that's reproducing some of their pain in their sort of anterior knee. There might be, if you have good lighting or good connection, you might be able to take a look at some of their, if there is sort of swelling or effusion. Hopefully wearing shorts like Dave, you can get them, that angle is pretty good from my perspective. Take a look at his knee, see if there's any asymmetries. You can even see if you can get them knees straightened side by side. You might be able to get a sense of observation of swelling. You could try to get them to do a self-swipe test. That one requires sort of getting them to move their hands along their knee 3 or 4 times, and then one swipe down the outside of their knee to see if you can see a lot of swelling coming back into the inside, or even just getting them to sort of flat hand push their knee one way or the other. You might be able to see if there's large amounts of swelling. You might be able to see some of the effusion through their knee joint there. One other special test you might be able to investigate if you're suspecting sort of a ligament or ACL or a chronic ACL, probably not very accurate in acute settings, but you can try to get them to do a bit of a self-anterior drawer, sort of having them in about that resting position, 30 degrees of knee flexion, then seeing if they can locate that bone on the front of their leg, and then trying to see if they can pull their whole leg forward or backwards, or just wiggle it around, see if there's sort of more give there, or if that sort of is what is provoking their pain. There we are. I think that's all the topics I wanted to cover for the knee for this exam.
There, you could, I guess, do some palpation with the patellar ligament and around the area if there was.
Yeah, IT band friction syndrome. That test, of course, if you get them to locate a sore spot, if they're palpating along the side, you can locate a sore spot. That compression test for IT band friction syndrome is putting pressure and then bending and straightening the leg. If that's sort of reproducing a bit of that friction for runners that have a bit of that lateral knee pain might be an option. Palpation through the medial joint, even the lateral joint can be relatively specific for meniscus or meniscus degeneration. So getting them to palpate through some of those areas you might be able to locate the sort of sore spots through the medial or lateral knee.
Okay. Okay, thank you, Jessica. If you have any questions, feel free to reach out, Dave B at backinmotion.com, or preferably Jessica E at backinmotion.com. Okay, thanks so much.
Thank you very much.